Breaking news coming in. National expert group on vaccine administration to decide soon on how long one should wait to take vaccine after recovering from COVID. So once you recover from COVID, the gap that you should wait before getting your first jab. National Technical Advisory Group on Immunization has advised up to 9 months post-recovery. Sources in ICMR are saying that considering India's case burden, waiting for 3 months could be adequate. Some studies from other countries indicate that one might have immunity for about 6 months or so. Let's try and get doctors to tell us whether this is the ideal time one should wait or not. And Milan to join us on the latest indication that is coming in from this particular expert group. Milan is joining us for the latest. Milan, the National Expert Group on Vaccine Administration to decide soon on how one should wait. And the Technical Advisory Group has said wait for 9 months post-recovery. But we do know Dr. Guleria on record has also said that 4 to 6 weeks wait after recovery from COVID is enough to take the first jab. Then why this particular indication coming in? Is this indication backed by some sort of scientific evidence?
Chetty, as we discussed last time, the CDC in the US recommends about 90 days is when one should wait to take the vaccine after recovery. But the NTAGI recommendation says, and it's based on some data that sources have told us is from US, Germany, as well as from the UK, that antibodies and the amount of time that it lasts in the recovered person's body is seen to be somewhere between 6 to 9 months. But that could vary, and that is why the recommendation now says that you could have to wait from anywhere between 6 to 9 months to take your first jab after you recover. But sources in the ICMR who I have spoken to have said that considering a country like India, its case burden, as well as the possibility of reinfection after recovery, which is also high, it would probably be adequate to take the vaccine after 3 months, which is something that's considered and recommended. Because currently India is in the throes of the second wave and we haven't still seen a complete plateauing of cases throughout the country, which is why the possibility of reinfection is quite high. Now, these recommendations are to be seen by the government of India today. The NTAGI experts will be taking a call on this today. And it's going to be very important for us to see when exactly India and the Indian government think that one should be taking the jab, because sources have also told us it's related to a vaccine sparing strategy. The longer time we have to wait to take the COVID-19 jab, we'll have more doses as well. And I'm sure experts will also weigh in on the fact that right now we have shortage of doses. But in the near future, probably perhaps after June, July, when productions will be ramped up, we might have more vaccines. So the sense of increasing the time to be taken to wait for the jab could actually lead to reinfections, which we have seen in a lot of cases in the last 6 months. Chetty, you'll also see that a lot of people have tested positive after recovery from COVID-19 within a span of a month and 2. So there seems to be a difference of opinion on the science evidence based for this particular recommendation.
You know what, Milan, you are tracking the health beat very closely, and you're absolutely right, because this is a little different from what the doctors have been indicating, and hence we will get doctors to come and explain to us what the time period, the wait period needs to be after recovery to go take your first jab. Right now, the National Technical Advisory Group on Immunization, as Milan is reporting, has advised up to 9 months post-recovery. But Milan, with that perspective, is also going to be joining us very soon with the doctors to basically understand the subject much better. And on the back of what scientific evidence has this indication really come in?